Zinc balances immune responses and also has a proven direct antiviral action against some viruses. Right, now let's just notice the words there. Proven, direct, antiviral action against some viruses. So this is a known antiviral mineral. This is already known. This is not something new and speculative. And given that, you've really got to wonder why there's been no randomized clinical trials organised on this. It really is surprising. But let's go on. Zinc deficiency is a common condition in elderly and individuals with chronic disease. So this is not unique. And we'll see in Spain, the zinc levels in Spain do seem to be quite low. Increased intracellular zinc concentrations efficiently impair replication of the virus. Now here it's talking about the SARS coronavirus 2 virus, the COVID-19 virus. So that they are saying here that increased intracellular, that's inside the cells, zinc concentration impairs viral replication, which of course is exactly what we want. We don't want this virus reproducing all over the place, resulting in a lower number of viruses. So just by way of background, these are things that are really already known. The case is starting to get interesting, isn't it? Now, too many of these cytokines, which are cell-to-cell communication molecules, are released. They stimulate this massive inflammatory effect, and we get the problems such as severe acute respiratory distress syndrome, for example, which we don't want because it's caused by the inflammation. So they suppress the excess pro-inflammatory cytokines, regulate expression of ACE2 receptors. Now this one is quite specific to COVID-19 because, as you know, the ACE2 receptor is the way the COVID-19 virus gets into the cell, binds onto the cell. And just to finish this brief introduction, epidemiological and clinical evidence is increasing, and it's related to the incidence, the severity and the mortality in COVID-19. So there's increasing evidence that having good levels of vitamin D reduces the incidence, the number of new cases of COVID-19, how sick those people are and how likely they are to die. And low levels of vitamin D are also associated with high blood pressure, diabetes, cancer, cardiovascular disease. So if people had good levels of vitamin D, perhaps there would be less of these. But of course, you can immediately see, whether that's true or not, that all of these conditions are comorbidities: the hypertension, the diabetes, the cancer, the cardiovascular disease. So we can see it's all kind of going together. So lack of vitamin D, which is basically a pandemic, there's a great lack of vitamin D around the world, is something which would be so easy to correct, and yet governments don't seem to be acting on it. Right, let's get down to specific evidence. Now, this is the initial clinical trial study. We looked at this in great detail, effects of calcifediol. Now, some people say, I was brought up to say calcifediol, some people say calcifediol, but I was brought up to say calcifediol. I think that's more the English way to do it. So basically these patients in this clinical trial in Spain, relatively small number, but some were given calcifediol and some were given nothing. Now calcifediol is what the body turns the vitamin D that you take in the tablet or in your diet or in the sunshine into. So if I'm exposed to the sun, my skin makes this vitamin D3, or if I take vitamin D tablets, D2 or D3 tablets, that goes into my blood, but it takes up to about a week for the liver to convert it to calcifediol, which is then further processed by the kidneys. It's quite complicated. So when these people were sick, they gave calcifediol, and that basically meant the vitamin D was working straight away, rather than waiting a week for the liver to convert it into the active form, because these patients could have been dead within a week. So that was why they gave calcifediol. But basically it's the same as giving vitamin D. It's just that it works quicker. So, and the results of this now are well known. 50 patients treated with calcifediol, 1 required admission to intensive care. 1 required admission to intensive care, that's 2% of the sample. None of them died. All discharged. All 50 patients, no deaths. All discharged without without complications. Zoomed in today, maybe. There we go. So the patients that were given the calcifediol, the vitamin D, fast-acting vitamin D, no deaths, all discharged, no complications. The untreated patients, 13 of them required intensive care. That's 50% of them, and two of those patients unfortunately died. Now, what I was distracted by there was the leaves blowing into the window. It's autumn time. There's less sun. We're not making the vitamin D we did in summer. And of course we have a massive second surge all over the northern hemisphere.